Nurses in Iowa are fighting an unprecedented anti-union campaign, and the hospital system UnityPoint would rather spend millions on anti-union educators than on safe staffing policies. I'm reading from the American Prospect here. If formed, the union would work with the Teamsters Local 90 and represent about 2,000 nurses across Iowa Methodist Medical Center, Blank Children's Hospital, Methodist West Hospital, and Iowa Lutheran Hospital. Nurses have always been at a higher risk of workplace violence. 8 in 10 nurses have experienced some form of workplace violence in the last year, according to a 2024 report. Half of the nurses they surveyed said that instances of violence are only increasing. The hospital needs more security guards so they can respond to emergencies faster, more nursing staff so patients can get proper care, more support from management when a nurse is attacked, more breaks during the day, or any breaks at all, and more patient care technicians to assist the nurses. The nurses were supposed to vote in a union election on October 5th, but because of the government shutdown, that is now delayed. Until then, they'll have to continue fighting an unprecedented union-busting campaign UnityPoint is waging against them. Union watchdog Labor Lab has estimated the hospital system has spent somewhere between $3.7 million and $6.1 million on anti-union activity at a time when the company has resisted spending more on staff or safety measures. Labor Lab also estimates that UnityPoint is spending somewhere between $20,000 and $34,000 every day on the anti-union campaign. One nurse said that she can actually remember in her first job being so overwhelmed as a new grad with 6 or 7 patients under her watch and no help available that she felt underwater. She looked at one of her coworkers who had been a nurse with UnityPoint for probably a decade and said, "We need a union because this isn't sustainable." He told her to shut up and never mention that again. In addition to concerns about their personal safety, the nurses the prospect spoke to consistently brought up patient safety as one of their main motivations for organizing a union. One nurse described having to juggle multiple critical ill patients when each of them needed her full attention. All told, the Teamsters has filed at least 7 unfair labor practice complaints against UnityPoint, alleging that the hospital system and its consultants are engaging in illegal surveillance, discipline, and threats, among many other complaints. Most of the nurses told the American Prospect that they're cautiously optimistic about the vote, but if the union effort isn't successful, some nurses say it could be the final nail in the coffin for their careers with UnityPoint. You can sign a petition to show your support here. Read more over at Iowa Starting Line. Thanks for watching.